As the fallout continues from the financial crisis at the state health department, community health leaders and centers and other programs that receive funding from the agency are still picking up the pieces. New revelations that funding cuts were unnecessary have left health care providers frustrated and wondering if they'll ever see the money that's needed to expand vital services to some of the state's most vulnerable residents.
Federally qualified community health centers like the Perry A. Clausen Family Medical Center in Oklahoma City are often the providers of last resort for Oklahomans who lack health insurance. Centers like this one handled more than 200,000 patients in Oklahoma last year. Don Anderson is Director of Behavioral Health for Community Health Centers of Oklahoma.
The largest percentage of the patients that we see are not covered by insurance, and that being either private insurance or federal or state, which would be Medicare or Medicaid. So consequently, the people here have to have a great out-of-pocket expenditure, not only for their health care visits, but also for prescription medication.
For the uninsured, health centers like this provide discounted services with a sliding fee scale based on the patient's income. Last fall, as alleged financial problems surfaced at the health department, the agency canceled contracts with community health centers worth almost $2 million, money which in the past had come from the state's uncompensated care fund. Then last week, Oklahoma Attorney General Mike Hunter and State Auditor and Inspector Gary Jones held a news conference to announce that the health department's financial problems were, in fact, not real.
When you came back and looked at this, you realize that they created their own crisis that didn't have to happen.
Lou Carmichael, the CEO of Variety Care, which operates 16 centers across Oklahoma, says they've actually been dealing with declining funding from the health department for years, with the same reason always given: there just wasn't enough money.
Which we know now was not true. They've never had a budget crisis. They had plenty of money that was allocable, that was unknown to the public, and so these contracts through the years have been cut. This is just the most egregious example, but it's been cut year after year for the last 8 or 9 years.
Brent Wilborn, Director of Public Policy for the Oklahoma Primary Care Association, says the loss of funding has been difficult for community health centers.
So we have had some community health center locations that were closed or consolidated. We've had points in time, including this year, where health centers had positions they really needed to fill, but they weren't able to do that.
Carmichael says Variety Care also had to cancel proposed plans to expand services as a result of cuts.
We had plans to expand hours of operations to open access in the evenings at all our sites. We did not do that. We had plans to put Saturday and Sunday hours of operations. We are not able to do that. So we really had to scale back to more of a Monday through Friday, 8 to 5, which is not when people actually need access to care.
For the working poor, taking time off to get medical treatment often means going without pay.
Many times we have working individuals that simply are not able to take off during the day, and they still want to do what they can to take care of themselves and their family, and those after hours become very, very important as far as them having the time and the ability to get there.
The health center model.
Carmichael says she's frustrated by the debacle that has played out at the health department, and not just because of its impact on community health centers.
The same exact thing happened to child abuse and neglect services, and I feel as strongly about that as I do about primary care. These are the programs that actually help the state become more healthy and helps people have healthier families, and prevention and primary care is the one thing we should not be cutting.
Sherry Fair is Executive Director for Parent Promise, a home visiting program which teaches parenting skills and offers services such as child abuse prevention counseling.
From the time period of 2010 to 2016, Parent Promise has served just over 800 families, and of those families that we served, we have a 95% success rate that none of those families have had a substantiated case of child abuse and neglect with the Department of Human Services.
Fair says they've received donations from the private sector, which has allowed them to keep operating, but believes they could have done so much more had the health department not canceled their contract.
if we invest now and we expand services and we can help families become self-sufficient, they actually become contributing taxpayers, which helps our community, it helps our state, but most importantly, it helps them.
While programs like Parent Promise and community health centers remain hopeful the health department will reinstate contracts once the dust is settled, the reality is that no additional money was given to the agency next fiscal year for that purpose, and it's likely to be several months before any decision is made on restoring funding.